So ITP, really the immune system triggers these attacks on platelets, not just through one pathway, but actually through multiple different pathways. You know, our immune system is really quite complex, and I think that that's really important to understanding ITP, is that there are sort of several different mechanisms through which these platelets can be destroyed. So we know that the platelets are erroneously marked for destruction. They're sort of a little marker that's placed on the surface of that platelet. And then there are other pathways that are actually attacking the platelets directly, even in the absence of the marker. And so, this is really not a straightforward, just one pathway. WAYRILZ is approved for adults with persistent or chronic ITP who received a prior treatment that did not work well enough. This means that really WAYRILZ can be used quite early in the disease course of ITP, as early as 3 months for patients who maybe have tried and failed the steroids or other treatments that we think of rescue treatments like IVIG. It's what we call a BTK inhibitor. And so BTK inhibitors have been around for a while to treat other types of diseases. So this is sort of a mechanism of therapy that we have some experience with. But WAYRILZ is a BTK inhibitor with specific properties that really make it ideal to restore the immune balance for patients with ITP. So WAYRILZ is a unique treatment for ITP because it's really designed to restore order, to get immune balance back on track. BTK is a key protein that is involved in this the body's own immune system attacking the platelets. BTK is really sending out signals for immune cells to respond to threats, and BTK is involved in destroying platelets in multiple ways. In some cells, it helps to create tags that mark the surface of the platelets and sets them up for destruction. In other cells, it actually helps to carry out that actual destruction of the platelets themselves that have been tagged. WAYRILZ works by blocking BTK, which helps interrupt the harmful immune signals that drive platelet destruction. By doing that, it helps in a few important ways. First, it prevents autoantibodies from marking platelets for destruction. And second, it helps stop the immune cells that would normally carry out the attack on those tagged platelets.
As a quick summary, ITP triggers multiple attacks on platelets. WAYRILZ is a BTK inhibitor designed to target key sources of ITP and works in multiple ways to protect platelets and help restore immune balance. Important safety information. What should I tell my healthcare provider before taking WAYRILZ? Tell your healthcare provider about all of your medical conditions, including if you have liver problems, have kidney problems, are pregnant, or plan to become pregnant. WAYRILZ may harm your unborn baby. If you are able to have a baby, your healthcare provider will do a pregnancy test before starting treatment with WAYRILZ. Females who are able to become pregnant should use an effective birth control during treatment with WAYRILZ, and for 1 week after the last dose, are breastfeeding or plan to breastfeed. Do not breastfeed during treatment with WAYRILZ, and for at least 1 week after the last dose. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking WAYRILZ with certain other medicines may affect how WAYRILZ works and can cause side effects. WAYRILZ may also affect how other medicines work. What should I avoid while taking WAYRILZ? You should avoid grapefruit, starfruit, and products that have these fruits, and Seville oranges, often used in marmalades, during treatment with WAYRILZ. These products may increase the amount of WAYRILZ in your blood, which increases the risk of side effects of WAYRILZ. What are the possible side effects of WAYRILZ? WAYRILZ may cause serious side effects, including serious infections. WAYRILZ can increase the risk of infections, including serious infections that can lead to death. Your healthcare provider will check you for signs and symptoms of infection during your treatment with WAYRILZ. Tell your healthcare provider right away if you get any signs or symptoms of infection, including fever, chills, or flu-like symptoms. Liver problems including drug-induced liver injury, DILI. Liver problems, which may be severe, life-threatening, or lead to death, have happened in people treated with Bruton's tyrosine kinase, BTK inhibitors. Your healthcare provider will do blood tests to check your liver before and as necessary during treatment with WAYRILZ. Tell your healthcare provider right away if you have any signs or symptoms of liver problems, including stomach area, abdominal pain or discomfort, dark or tea-colored urine, or yellowing of the skin or the white part of your eyes. The most common side effects of WAYRILZ include diarrhea, nausea, headache, stomach area, abdominal pain, and COVID-19. These are not all of the possible side effects of WAYRILZ. What is WAYRILZ? WAYRILZ is a prescription medicine that is used to treat adults with persistent or chronic immune thrombocytopenia, ITP, who received a prior treatment that did not work well enough. It is not known if WAYRILZ is safe and effective in children. Please see accompanying full prescribing information, including patient information.